This is Dr. David coming to you from Montreal, Canada, and this is the Retina HotMic case series from Eye Care PD, where the PD stands for Professional Development. Today's case, I'm going to show you a case of a 63-year-old woman who presented to me Vision 20/30. She was seen by her optometrist, and some retinal findings were noted, both on the color examination and more markedly on the OCT, sent to me for an evaluation to assist with diagnosis and determine if any treatment was necessary. So what you'll notice right away is that we're looking here at an image of the right eye. You're going to notice there's this small hyporeflective area. We would typically refer to this as actually some subretinal fluid. As we delve deeper into the case, you'll wonder if that's actually true subretinal fluid or just an area of some cavitation. We're going to get to that in a minute. But you've certainly got these other areas of these empty cystic-like structures. Again, as we delve deeper, you're going to wonder if this is true fluid or just cavitation. What you'll notice here is that you've got significant loss of the ellipsoid zone. So that's really missing in its entirety throughout. This section here, and that retina almost dunks down right into the underlying RPE. You've got here this area of hyaloid sort of draped over the underlying retina, and I'm going to scroll through a few images for you. We're just going down now through the fovea, continuing on the other side. Again, you can see. And what I can do for you is I'll actually bring the marker over so you know where it is. And where is that in the eye? Well, that's actually temporal to the fovea. So there's your fovea, and just temporal to it, you've got this abnormal area that I submit to you is more cavitation as opposed to fluid. And it's a fairly typical picture that we see with this diagnosis. Let me show you the fellow eye. Here we go, is the fellow eye. And again, you've got that similar appearance. Let me drag you over a slider so you know where we are. And that is, again, on the temporal side of the fovea. So this is a case of idiopathic macular telangiectasia. And this finding on the OCT of a combination of ellipsoid zone loss, atrophy, the retina dunking down into the RPE, which is very common in areas of atrophy. These more cavitation-like areas, you'll notice that the foveal contour is relatively intact, and you've really just got what we call flat cysts. I'm going to flip back to the other eye. It's a little bit more prominent there in terms of those flat cyst-like structures. You can see that the contour of the fovea is maintained, but you've got these areas of atrophy. Again, temporal aspect, this is pretty common for macular telangiectasia. Let me just pull up a color image for you of the right eye, and this might help a lot, right? You can see this area of pigmentation on the temporal aspect of the fovea. You wonder if these vessels are a little bit right-angled, a little bit abnormal. You've got these dots here. I agree, you can't tell on this image if those are some drusen or hard exudate, or actually the crystals that we talk about with IMT or idiopathic macular telangiectasia, but you've certainly got a few changes that would alert you to something going on. I used to do a lot of fluorescein angiograms to check these patients. At this point, I really do it only in suspicious cases of choroidal neovascularization where I'm not sure. This case is definitely no choroidal neovascularization, but I did get the OCT-A, the OCT angiography, and this area of vessel, where the vessels are really very sharply angled out from each other, is abnormal, as are these areas of capillary dropout. You'll see this more commonly in diabetics or ischemic retinopathy, but again, you'll also see this abnormal area of vascular change, particularly marked temporally, common in idiopathic macular telangiectasia. Pulling back to that OCT one last time, you know, It's all quite interesting, and if you look at enough of these cases, you'll find that they pretty much all have very similar features and become easy to identify. So this is Dr. David signing off, and I am always learning.